I will now introduce our second finalist. Experienced pharmacist Thomas Kozge is the founder and owner of IntelligentRx. This is a digital healthcare startup located in Shakopee with a service product designed to increase access to affordable prescriptions for all Americans. Thomas has 10-year experience working in retail pharmacy and for health insurance. His passion is to help Americans afford their prescriptions so that they can get medications they need on their path to better health. Please welcome Thomas Kozge.
Thank you for that introduction. About 10 years ago, while I was working in a pharmacy, there was this lady that came to the counter to pick up a prescription. And so I went to help her, and she told me that she was picking up a prescription for her son. So when I went and I picked up the prescription from the shelf, and I brought it to her, and I told her that it was going to be $65. And when I looked at it, it looks like no insurance had been applied. So I asked her if she had insurance, and she told me that she did not have insurance. So I told her that that prescription without insurance was going to be $65. And she took a moment and she started tearing up, and she told me that she couldn't afford to pay $65 for that prescription. And it was actually a prescription for her son who had asthma, and it was an asthma inhaler. So I told her that I know that there's several discounts that I can apply, and I can take a moment to see if I can apply a discount on it. So I went back and I tried several of them, and I found one that took the price down to $18. So I called her back to the pharmacy, and I told her that this prescription, I was able to get it down to $18. And she was very happy, and she thanked me so much. And she said that if I was not able to bring that prescription down to $18, she would have been able to afford groceries for the following week. And I ran into several situations over the next couple of months, and it actually led me to start this company, IntelligentRx. So IntelligentRx is a prescription savings innovation startup located in Shakopee. Our main goal really is to increase access to affordable prescriptions for all Americans. And we just want to make sure that people are not overpaying on their prescriptions. I'm sure most of you have been to the pharmacy to pick up a prescription, and you've complained several times that why is it so high? And according to Kaiser Family Foundation, more than 200 million Americans overpay on their prescriptions every single year. And there's several things that go into this. One of the main reasons is that more than 60 million Americans don't have insurance at the moment. So prior to COVID-19, there was about 40 million, but now there are 60 million, and that's due to a lot of people who've lost their jobs because of COVID-19. And then for those people who have insurance, most Americans get insurance through your job, and for the most part, you always get a high deductible plan. And if you have a high deductible plan, for the most part, you have to pay the full cost of those prescriptions or whatever health care you get until you meet your deductible. And the other thing I'll show you guys down here is prices vary wildly from one pharmacy to another one. And then finally for this, several people skip prescriptions, and I can tell you guys from working in the pharmacy, every single day there's at least someone who will come to the counter and you tell them the price and they say, I can't afford that, I'll skip that for this month. And the solution is, we've created a website whereby people can comparison shop their prices from one pharmacy to another one. We're going to provide savings up to 85% of the retail price. And our website it's free to use, and you don't even need to sign up or enroll. You just go onto our website, it's IntelligentRx.com, and then you can put in the price of your medication, and you can find coupons that you can use. So how it works is you go onto our website, you just search the medication that you're taking, you compare prices from local pharmacies where you live, and then you're able to print or download a coupon that you can show to the pharmacy staff and save money on that prescription. This is an example of one medication that I searched, and the zip code that I used was the zip code for Shakopee. And you can tell, for this specific prescription, you could pay $14 at Hy-Vee, $24 at CVS, and $187 at Walgreens. And that tells you how prices vary wildly. This is a coupon that I printed from our website, and if you can look to the right, these are the 4 codes that you'll really present to the pharmacy to be able to get that discounted price. And this coupon is specific to amoxicillin, which is a very common antibiotic. And if you're getting 21 capsules and you'll pay $6.66 at CVS. Without insurance, the full retail price on this prescription would be $18. So you're saving someone at least $12 on this. Our business model, we make money really on referral fees. Since our website or our services are free, no one pays for them. Every time someone gets a discount and uses a discount from our website, we get a transaction fee. These other 2, we haven't really implemented them. Our plan is to do some advertising, which is very targeted, and also once we have more users, do a subscription model whereby someone would pay a fee monthly and they can even get to save more money. Pharmacy is a very huge market. The total addressable market here is about $320 billion, but our target really is the out-of-pocket spending, which is about $65 billion in 2019. For the competition, there's quite a bit of competitors in this field. The biggest one that you guys might know is GoodRx. They just went public last month, and I think they're currently valued more than $10 billion. So it's really the biggest company in this space. There's some issues with them though. One of the biggest one is they charge a bigger transaction fee, and sometimes some pharmacies do not accept them. So what we've done is to differentiate ourselves from them is we used a different model with the PBMs that we've signed. So we don't charge a higher transaction fee as compared to them. But the biggest thing that we really want to do is we want to educate consumers on really other ways of saving money. So one of the things that we are going to really do is have a blog whereby people can come and read on how to save money on several classes of medications. Also have a YouTube channel whereby we teach people on how to save on prescriptions, which no one's doing at the moment. Our growth strategy, for the most part here, we've really done marketing as directly to the pharmacies and just phone calls from one pharmacy to another one. Prior to COVID-19, our aim was to also do physician outreach, but we haven't done that because the foot traffic to really doctors' offices has been, it's not allowed at the moment because of COVID-19. But the main thing we really want to do to expand is direct to consumer. We would like to launch some apps in 2020. Also need to get a social media presence, do some YouTube, and then finally down the road, once we have more revenue, we can do print or even TV advertising. For our traction, as you can see from this, prior to 2020 first quarter, we were actually growing at about 25% month over month. And then you can see there was a little bit of a drop because people just stopped filling prescriptions when COVID-19 started. But you can see from this, at least Q3 of this year, it went up a little bit. So our coupons are used to fill about 9,000 prescriptions every month. And we are growing right now at about 6% month over month. For the 2019 revenue, our revenue in 2019 was $65,000. And for this year, from January until September, we've actually made $175,000, and we are on pace to make around $245,000 for the year. And for 2021, we are projecting that we'll hit more than $500,000 in revenue. And since we started this company up to now, we've saved Americans $1.9 million. And if we were to win some of the funds or win this fast track challenge, we'll really use some of that money we would like to hire more people. We are currently 4 employees at the moment. I have an account manager. We have a senior engineer who's working on the website. So we'd like to hire more people. We'd also like to use the funds for IP. We need to trademark our name and some other service marks that we have. And so mostly for legal protection. And to conclude, we're really trying to empower consumers to save money. And that lady that I mentioned to you guys, I spoke to her several times after that encounter. Her name's Nancy. And every time she came to the pharmacy, she was able to pay $18 for that inhaler. And she was always very thankful. And that is one of the main reasons why I started this company. And it's quick and free to use our website. Thank you.
Thank you.
Great job, thank you.
Thank you.
Help me understand, who pays the referral fee? I didn't follow that piece.
So the way that works is, so we form partnerships with pharmacy benefit managers and pharmacy benefit administrators, and they're the ones. So it's really it's two ways. So the pharmacy pays us a transaction fee to the PBM, and then they also charge a small portion to the manufacturer, and then they share some of that with us.
Great, so so manufacturer, pharmacy, I'm just trying to follow the cash, if you will. Then they pay a fee back to the BPM.
PBM, yeah.
And then they pay you.
Mm-hmm.
Understand. So my next question is, does the coupon, does it impact the gross margin at the pharmacy level? So if a coupon is used, does Walgreens make less on that prescription fulfillment?
No, they don't. Typically, the markup on prescription prices is it's huge. So normally, a pharmacy will pay for, an example is one medication that I know is they buy, for 90 tablets, they pay $2 to buy it. And if you were to go and buy it without insurance, you're gonna pay $365 for it. So the markup is very huge. So the way this works is, if you were to use one of our coupons, you would end up paying $38 on that prescription. So the way the PBM works is they charge a small portion to the so the pharmacy pays the PBM, and then the manufacturer, based on the manufacturer who manufactured that prescription, the PBM will recoup some money from them as well, and then they share that with us.
Understood.
Mm-hmm.
And my last question, when they go to your website and they type in a medication into your search engine, approximately, what percentage of potential medications that they could type in would you be able to provide a coupon today?
At the moment, any prescription that's available, you should be able to get a discount on our website. But we still have some other things that we need to integrate. It's like API integrations. We need more. Currently our website does 4 API integrations, but there's more that we can add to provide more savings.
Great, thank you.
Mm-hmm.
Thank you for your presentation. I have a couple questions about a pharmacy. How many companies like yours are they willing to work with as it relates to providing kind of these discounts? So you showed it's kind of a noisy space, but are they willing to work with really anyone?
Yep, for the most part, anyone. And sometimes the pharmacies, the smaller chains or the independent ones don't like coupons for the most part, but at least all the chains do. So if you were to go to CVS or even Walgreens, they always accept them.
Okay, and then just a little bit of a follow-on. Are you able to negotiate kind of better or deeper discounts than someone else? So is that an advantage for you as well? Or as you're entering that space, the level of discount that you can negotiate would be at an equivalent level of some of the big players like GoodRx?
So what we've done is we actually our contracts are mostly towards pharmacy benefit administrators, and those ones they are more easily acceptable because they don't charge a higher fee to the pharmacy. So those ones, we are going to provide lower prices by doing that even than some of the biggest players in the market.
Can you talk just a little bit about marketing strategy of how are you, what is really your catch or your hook that I should use your site versus someone else? And as you're growing those prescriptions, maybe talk a little bit about how you've been able to do that, and then what does it look like really in the future about how you're kind of adding clientele?
So for the past year and a half, what I've really done is, it's been mostly foot traffic to the pharmacy. There's even sometimes in 1 month I would fly to a bigger city and I would go from one pharmacy to another one for 4 straight days, just giving out like discount cards. We do have discount cards like this that you hand down to pharmacies or people and they can use them. But to be able to scale this business, we really need to have a digital advertising, get social media, and that's what we are planning to do next year. Social media advertising, and then on sites whereby people come for healthcare services, really advertise where our consumers are.
So I congratulate you on, coming up with a business that's really going to do well by helping people. I think that's always great when everyone's interests are aligned, and this is clearly a massive problem here in the U.S. Healthcare costs are out of control. So thank you for tackling this and doing your part. I was wondering if you could talk a little bit about your customer base, and I know you had said that once you get to a certain user base, you hope to maybe shift to a subscription model. It looked like there was no user login on to access the coupon, and so I'm just wondering how you're able to track, how many users are using it, and if you're getting repeat users coming back, other than the one you mentioned, right, that are finding this is great and it's going to be my go-to site I'm going to use for this in the future.
Okay, so what all the PBMs that we use do is they give you a report on a monthly basis that tells you which pharmacies the coupons are being used and then how many were used in that pharmacy. But our website, we are planning. We haven't started doing any as much tracking. We just need to be able to track what pages are being viewed, how many coupons are being downloaded, and all that kind of data. But we are planning on doing that.
Okay, thank you very much.
Thanks for coming in.
Thank you.
This is it's a noble idea, and it sounds like it came from a pretty powerful experience that you had, and so kudos to you for following up. The question, to me, it sounds like your biggest asset is your website.
Mm-hmm.
Who is responsible for the back end of your website? Is that you? Have you used the development team?
So I initially
in the U.S.
Are you okay? I'll wait for you. Are you all done with the question? Okay, sorry. So initially, I actually used a local web development agency to build the website for me, and then currently I do have one senior engineer who does everything. So we use cloud computing for the back end to aggregate the coupons and do some. Yeah, there's more that goes into that. But currently we do have one senior engineer. We need to actually hire more that like a DevOps engineer that will be able to come and really improve our website. Currently it takes about 15 seconds for you to get a coupon, which is way too long. We would like it to get it to under between 7 to 10 seconds to be able to download, to get to a coupon. So our search process takes a little bit longer than we would like at the moment.
We've got time for about one more question, judges. It's your turn.
Hey, thanks for coming in. This was, out of the ones that we looked at, this is the one that's most unfamiliar to me coming from Canada, and you mentioned healthcare costs, and this is a mystery. I don't think that you would find that kind of a swing in drug prices. In fact, that's probably why Americans go over the border and buy in Canada, because there's fixed prescription filling prices and those kinds of things. But what was really interesting to me about this is you do have one company out there that's now $18 billion or 10, I'm not sure which number is more current. Maybe that tells you about the volatility of the capital markets as regards IPOs and startups in the pharmacy business. But I know this is a huge political issue, and depending on which way the next couple of weeks go, could a policy change wipe this business out? In the sense, if they want full transparency or something like that?
Yeah, it's possible. I think the thing that could possibly wipe this kind of business out would be something like American, they would come up with like a single payer system, but I think that's probably,
I'd bet against that too.
If that was to happen, I would be happy to hang my hat on and move on to another problem. But it's possible. But I think it's not likely, because the way our healthcare system here works is very complex. Like most other countries, you don't even see advertisement for prices.
I just want to get one more. So what's to stop Joe and I from building this website? I know I can't do it. Joe probably can't. He's smarter than me. But what's the barriers to entry? You've got GoodX or GoodRx at that. There's you as a small startup, and probably 100 more that we haven't heard about, like you. How hard is this?
I think it's because it depends with the relationships that you really have with the PBMs, and also we plan to incorporate an algorithm in our search process. There isn't really any barrier to entry. Anyone can really start it, but I believe, so once we are able to improve this a little bit, we'll also add some algorithms that we can patent. Because GoodRx actually has 2 patents on this. But we plan on doing that a little bit
Are
different.
the algorithms around collating the prescription or the prescription information?
Yep, and aggregating the data.
Okay.
Thank you so much, Thomas.
Thank you.